TGG-ALM. And this is implemented by a consortium that is led by Options Consultancy Services. The consortium members include AMREF Health Africa, ActionAid, ORCID Project, and Africa Coordinating Center for the Abandonment of FGM. Program also works closely with Population Council's Data Hub, the program's data measurement arm. Our vision as a program is a world where girls and women can exercise their power and rights, where they have expanded agency and are free from all forms of violence, including FGM. Our program work is underpinned on the do no harm principle, ensuring that survivors, champions, and communities we work with are safeguarded. As such, I want to highlight a few things. First, today marks the beginning of the 16 days of activism against gender-based violence, which runs from the 25th of November to 10th December every year. The theme this year centers on ending digital violence against all women and girls. Allow me to mention that the girl generation recognizes female genital mutilation as a form of violence against women and girls and a violation of their human rights. This is therefore to remind us that any conversation around FGM may be triggering, especially for the survivors. We therefore urge all participants to engage with care, respect, and empathy. If at any point you feel overwhelmed, please feel free to take a break because your well-being is our priority. As mentioned, this session will be recorded and shared afterwards through our YouTube channel with stakeholders. A reminder that this webinar will be conducted in English. However, we have interpretation available in French for those who are just joining us now. We also have interpretation available in Amharic and sign language. If you want to listen into any of the languages here, please click on the globe icon to select your language preference. For French, click French. For Amharic, click Amharic. And for English, it's where we are. You are listening to us in English. Thank you so much. Now, the topic of the webinar is girl-centered programming in ending FGM, proof of concept in Somaliland, Senegal, and Ethiopia. And here we will focus on key findings from a series of program assessments that we did earlier this year. This was a process to review whether our approaches to end FGM are promising in terms of shifting attitudes towards ending FGM and whether they are sustainable and potentially scalable to other areas. Our speakers will explain what the proof of concept assessment is, what we learned from it, and the resulting recommendations and next steps. We will have time for questions at the end from participants of this session. This webinar builds on last year's webinar on proof of concept assessment that was done in Kenya. My colleague, Mark, will share the link to that assessment. Mark, over to you to share that. And my name is David Kawai. I am the Community Engagement Lead for the program, and I am based at AMREF Health Africa, and I will be your moderator for this webinar. Our speakers today are Peris Omwenga, the Monitoring, Evaluation and Learning Officer. We will have Jane Meme, the Monitoring, Evaluation and Learning Lead. Both are based at Options Consultancy. And also, we are also joined by Ramatu Bodrago, who is a PhD holder and a research scientist based at Africa Population Health and Research Center, APHRC. Now, at this point, allow me to take this opportunity to introduce our first speaker for today, and that is Paris Omwega. Paris is a monitoring, evaluation, and learning professional with experience supporting health, gender-based violence, education, livelihood, and child and youth-focused programming across humanitarian and development contexts. She works very closely with consortium and grantee partners in Kenya, Somaliland, and Ethiopia. Paris will give us an overview of the proof of concept process and why it is important to the program and wider stakeholders in the End FGM movement. Over to you, Paris, to give us your presentation. Thank you.
Thank you, David, for the introduction. So I'll start by giving an overview of the Girl Generation support to the Africa-led movement to end FGM program. I'll start by saying that we are not a movement ourselves, but we support an already existing Africa-led movement to end FGM. So we do this mainly through varied community-based interventions carried out by our implementing partners and grantees, through advocacy interventions, as well as movement building, complementary regional and global work. The intent of the TGG-ALM program is to build an evidence base on what works to end FGM by designing, assessing, and promoting girl-centered approaches at multiple levels. So this is at individual level, that is girls and boys, household and community level, strengthening health systems, as well as subnational and national levels. So what is proof of concept? The proof of concept is actually like a project pilot, only that it's a more intensive pilot that takes longer than usual program pilots, and it involves developing a model, testing it, improving it based on the learnings to ensure the interventions will lead to the desired results. So we started out small, co-creating locally led interventions to shift attitudes towards ending FGM in selected high prevalent regions across Kenya, Senegal, Ethiopia, and Somaliland. And before scaling and promoting these approaches, we wanted to know if the interventions were effective by assessing whether the interventions were leading to positive changes in attitudes towards FGM, if the interventions were desirable by assessing whether they were what people wanted and needed. We also wanted to know if they were viable by assessing if they were doable and practical. We wanted to know if they were, and finally, we wanted to assess other cross-cutting issues that are core to our program, such as if the interventions are girl-centered, if they are locally led, and if they are there to safeguarding and they do no harm principles. So if the answer to these questions was yes, then we would determine that we have achieved the proof of concept. So how did we assess the proof of concept? We reviewed monitoring, evaluation, and learning data from 3 years of implementation. We looked through school club surveys, tracking changes in attitude and knowledge. We looked through pre and post tests with the universities, faculties, and students. We looked through social movement scorecards, which is a participatory tool to track changes in collective efforts to end FGM. We looked through qualitative data from community members, including program participants. Additionally, we held a total of 46 reflection and feedback sessions or workshops with over 860 participants, including girls, boys, community members, and leaders from Senegal, Ethiopia, and Somaliland. The data was reviewed by the African Population and Health Research Center, abbreviated as APHRC, who are our monitoring, evaluation, and learning partners, helping us to not only assess the proof of concept, but also with the endline evaluation of the program. So that's basically why we are here today. And now taking it back to our moderator, David, to guide us in the next sections. Thank you.
Thank you. Thank you so much, Paris, for that very nice presentation. I would like to introduce to us the second speaker, who is Dr. Ramato Guadrago, a research scientist at Africa Population and Health Research Center in Kenya and a social and cultural anthropologist. Her research focuses on adolescent and young people's sexual and reproductive health, in which she explores, through the lens of social norms, productive navigation, intimacy, and public health policies. Ramato will talk to us through the headlines, talk about the findings from the proof of concept reviews across all 3 countries, that is Somaliland, Ethiopia, and Senegal. Over to you, Ramato, for your presentation.
Thank you so much, David, for handing over to me. And again, in the name of APHRC, I would like to thank the consortium partners for involving us in these great initiatives and allowing us to support the monitoring and evaluation of this program. So as you rightly said, I'm here to present some of the key findings and learnings from the POC process. Paris, next. Yes. And I think Paris touched on the different interventions that were implemented in the various countries, so I won't take time of that, but the evaluation, the POC process really touched on that, and the findings that we are presenting will be in relation with that. Next. So in terms of key findings, one of the major one that the POC brought out was the fact that TGG-ALM was presented by the partners as a locally led and a potentially sustainable approach. And in that, comparison was often made between the TGG-ALM program and previous programs, where stakeholders were talking about describing those previous programs as top-down programs that were involving a set of stakeholders and not and leaving out others that they considered as key. On the other side, the TGG-ALM program was described as a program where local agent of change. By that, they meant the grantees, the girls and boys, and also survivors, health workers, community health workers, traditional and religious leaders, among other set of individuals at different levels in those countries and regions where the program was implemented. So those local agent of changes were supporting to bring about change through awareness creation, through dialogues, through different activities they were playing, different role they were playing at the community level. And it also showed, the POC also showed a high level of local ownership of the program, and which shows evidence through the social change initiative that were happening in the different programs. So that's how the program was described, and showing how effective, but also how sustainable the approach was for the people on the country. Next. Another finding out also was specifically on the girl-centered approach, which was described also as something significant and very innovative. Why? Because yes, in each context it was implemented differently, and in some contexts it was adjusted. Like in Ethiopia, I think the other speaker, Jane, will touch on that. But yeah, while it was being implemented slightly differently depending on the context, what stood out was the fact that they all resulted in a more confident and articulated girls who are now advocating for change within the sphere of influence, which could be at the family level, within the neighborhood, at the community level, and in some cases, even at the regional or at the national or global level. So that was one of the key findings. And as part of the POC, while we were doing the meetings for the POC, we could see those girls in the way they were confident and handling the fight for ending FGM in the community. Another findings also that we saw as part of the POC process was the fact that the club model is showing that it's possible to work initially with kids on the topic of FGM and SRHI. So it's something that could be scaled, because often when you work with kids on that such sensitive issues like FGM, it's often difficult, but the TGM program has shown that it's possible when you do it within school, when you use the school model. And also we found that boys are now becoming, showing great interest on the issue of FGM, are becoming agents of change, are becoming champions. And we noticed that in all the 3 countries where the program is being implemented. And for some countries specifically, I will come to the country-specific findings, but for some countries, there were really the need of complementing this girl-centered approach with a range of adults in the wider community, getting the support to be able to implement some of the activities, especially when it was touching on adult or the elderly people in the community. Next. So here we have a few quotes from some of the girls who are showing how the capacity was strengthened And as you can see below, one of the girls in Seoul, in Somaliland, saying that it has given us the courage to talk about the issue and to inform the community that this is a harmful practice. And the quote below is from Senegal, where the girl also is showing how it has developed their leadership through the activities, the training they received, and has now made them be at the forefront of the carrying activities to tackle the issue of FGM. Next. So this is also a quote from a girl from Ethiopia, showing how effective the program has been in stopping FGM. Next slide. Now, another findings, a major one was also on the community dialogue, how it has contributed in opening the space for change within the community. When we were having the workshop with the community member, what kept coming out was that before gathering people to talk about FGM was like a no-go zone. If people come and they hear that it's about FGM, you will see them leaving, not listening. But with TGG-ALM, it's now possible because people can talk about FGM, they can sit together, discuss about FGM, and those was happening through intergenerational dialogue, through couple, through mixed genders. And so the dialogue helps break the silence, tackle the stigma, share information, encourage people also to reflect on their beliefs, on the norms that were driving them, and slowly leading to some changes in attitude and also some changes in practice. Next. So these are also some of the quotes from Somaliland and from Ethiopia, where people are talking about how the program has contributed to opening space for change, for opening space for people to talk and discuss about FGM to find solution and shift attitude and beliefs. Next. There are 4 findings I wanted also to focus on, and which was really on a context-specific one, was the fact that it has contributed to a wide range of locally influential champions. And I think I mentioned some of them, whereby you find people like health workers, religious leaders, traditional association like the EDIR in Ethiopia, FGM survivors, the youth volunteer, the former practitioner, who are now becoming agent of change, supporting girls, leading activities at the community level to change practice. And in some cases, we even found government and organization officials who also became champions as a result of the TGG-ALM activities. Next. Another findings also was on the grant mechanism. And we found out that investing in local community-based organization through the funding that they were receiving, through the training also that was coming with it, and the networking that it was creating among them, and the possibility of learning from each other has proven to be effective in driving change, in creating a movement. So altogether, that grant mechanism has led to a strengthened local organization ability to lead initiatives. And some of them even went ahead because the system was strengthened, the leadership was strengthened. They were able to put together a proposal, get into consortium, and raise funds to continue the activity, which is a clear sign of sustainability of the program. And now they are also working in synergy, and we saw small grantees being supported, being capacitated by the anchor grantees, showing also the the collaboration, the synergy, and also when it comes to implementing activities. Next. And another findings was also around the integration into the health system. And also has shown to be an effective approach because the program successfully managed to integrate the FGM response and prevention into the medical training curriculum for all these countries to be able to handle the FGM issue at different cadres level, including medical trainees, which now made them empowered to be able to prevent FGM through the information given to women coming for antenatal care or women coming for postnatal care, and also to handle survivors who comes for issues related to FGM. And also some of them were trained by the archives team, leading to shaping the public perception and even their own perception around the issue of FGM and how now they manage to treat FGM-related complication. Next. And another findings was also around the movement building. And as in that, we found survivors, the Survivor Leadership Initiative, and the Survivors Network being strengthened through the program. We also found in all these countries the emergence of women watch groups who act as referral points or could raise awareness or even alert in cases or around cases of FGM. There are also platforms that were created for local activists on global stages to be able to talk about. Examples are like the Women Deliver, where the activists, the survivors was given space to be able to voice around FGM at the global level. Journalists also, because we know they play a big role in whatever information is being thrown in the public space when it comes to FGM. So they were also trained and contributed to amplifying the stories of the survivors and enhancing awareness regarding the issue of FGM. And all that came with some media campaign during commemoration days like the Zero Tolerance FGM and also the 16 days against sexual and gender-based violence. Next. So these are examples regarding the change and shift in attitude. Some quotes from the partners around how effective the program has been in changing things by the grantees in Ethiopia. Next slide. So I wanted here to touch on the unique findings for the context. So like in Ethiopia, for instance, we found extension workers who were trained to work with parents during pregnancy and immediately after birth resulted in reported adverse cases of FGM. So the health extension workers were really key in Ethiopia in making change. In Somaliland, the program contributed to coming up with the first national policy against FGM, which is a key achievement. And in Senegal, the Bajungo group, which are sort of local community health workers and volunteers, have also become a champion as a result of their involvement in the program and pulling their attention. Next. So I will now hand over to the chair, David, for the next speaker. Thank you.
Yeah, thank you so much, Dr. Amato. That was a great detail. Thank you for sharing. Now, allow me to introduce our third speaker. Our third speaker is Jane Meme, who is the Monitoring, Evaluation, and Learning Lead for the Girl Generation. Jane has extensive experience in international development program management and monitoring, evaluation, accountability, and learning. She has led and supported various programs, including providing third-party monitoring services to various development agencies. Now, Jane's presentation today will focus on the key challenges emerging from the proof of concept and the resulting recommendations. She will also share a couple of examples of how the Girl Generation program has adapted its work as a result of the proof of concept. Now, for the details, let's hand over to Jane. Jane, over to you.
Thank you, David. I hope you can all hear me. Please confirm. Thank you. Yes, I'm going to share with you the challenges, the recommendations, and some of the things that we've done as a program since undertaking the proof of concept assessment based on what came out of that assessment, what are the steps that we have taken. Like has been mentioned, the proof of concept was in Senegal, Somaliland, and Ethiopia, Kenya having happened the year before. Next slide to get us started. Yes. So what are some of the challenges that came through from doing the assessment? One is that we are a girl-centered program, and we pride ourselves in taking that to the next level. But we realized, or what the assessment taught us, was that there is a balance that is required, and sometimes it's really difficult to get it right. In some contexts, like Ethiopia, girls wanted to do more. Girl champions wanted to do more than what they were already doing. In Senegal, girls required more support from adults to actually be able to then do as much as they would have wanted to do, because there was some backlash in countries like Senegal. We also learned that, well, it is easier to change attitudes, like has already been said, rather than beliefs. And therefore, as knowledge and beliefs shift more quickly, then we need to invest more time, deep reflections, and a lot of dialogue in ensuring that beliefs also come along as attitudes and knowledge is changing. So that was one of the sticky points for us to be able to invest more in changing beliefs, because that is where things were not happening as fast as the other areas. We also had unintended shifts in attitudes in some contexts. While we were hoping that we were working towards ending FGM, absolutely all forms of FGM, there was a shift from type 3 form of FGM to what was considered a much lesser form of FGM, that is SUNA. And also from cutting much older girls to cutting babies. That was also one of the other challenges that the program faced, as people adapted to this thing of changing from what they've always done to a new normal. Then it came with challenges of, let's have a midpoint before we can actually get to the absolute zero. And so that is one of the things that came out in the assessment. And then also program activities and to shift and adapt in response to conflicts and security concerns. And this was mostly in Somaliland and Ethiopia. Next slide. There was also the challenge of conflicting and confusing messages from champions and program implementers, particularly in Somaliland. And this had to do with the form of FGM, where it was considered if we did not do infibulation and did sooner, then we were actually making progress, or that was the kind of the desired change. As that zero tolerance program, TGG-ALM does not consider any form of FGM as less severe, because we work to eliminate or for the abandonment of all forms of FGM. So this was not a positive shift, as much as communities considered it a positive shift. we as a program do not consider that as what we are aiming for. So we consider that we would want to have zero tolerance where no girl undergoes any form of FGM whatsoever. Then also, as has happened as we noticed in Kenya when we did the proof of concept, there was a shift in terms of how people perform FGM in response to public attitudes and the awareness that was being created, the laws that exist. What happened is the communities or certain families then reverted or went to cutting earlier, just to make sure that they cut the girls before the girls have a voice to speak out. And so we had instances where there was earlier cutting, there was more cutting of babies, and then also practicing FGM secretively. And where there used to be ceremonies, now there were no ceremonies, nobody would know, other than maybe the immediate family members. And then, of course, also cross-border FGM. You are trying to get from where it is hot because people already know, and moving girls to across the border to where either there was no law or the awareness was not as high. Next slide. So then what was recommended for the TGG as a program after doing the proof of concept? We got the recommendation that we should encourage our local teams to test and learn to find the right format for community dialogues for their own contexts, because contexts are different. People practice FGM for different reasons, or the reasons that they give. Of course, we know the major reasons, but the reasons that people give are varied. And so we need to come up with a format where each community can come up with their own, what works for us. What kind of dialogue is going to be more effective? What is going to have the desired impact? And this is based on who makes the decisions in these communities, who is comfortable talking to who, and who is the most influential. And one of the other things, as you'll see in the next point, is that grandmothers sometimes are taken for granted. We think grandmothers, oh, they're not that influential. But actually what came through is that, especially in places like Senegal, grandmothers are very, very influential in whether a girl goes through FGM or not. And so the recommendation was that we identify and work closely with influential family members, such as grandmothers, who hold the swaying power as to whether a girl in that family undergoes FGM or not. Next slide. We were also asked, or it was recommended, that we strengthen and widen community strategies for wider reach. And this was to include the mainstream and digital media. You cannot work with young people these days and not have digital media as part of your media strategy. And so that was one of the recommendations. Also to enhance anti-medicalization of FGM and intensify FGM prevention and response training for medical professionals, because of the shifts that's happening in certain contexts where people tend to think, or community members tend to think, if FGM is practiced by a medical practitioner, then it is safer, and we do away with all the harmful, because they're running away from what you're saying is harmful, that we can actually have a medical practitioner conduct the CAT or FGM, and that makes it safer. And so there needs to be the incorporation of medical, the medics, and this can only be done by ensuring that there is intensive training for those that are providing healthcare services, so that they are not only in the prevention space, but also response, because when FGM happens and things turn bad, those children are brought to the hospitals. But also when women have to come much later to give birth and they have complications, it is the medics that have to deal with the complications of FGM. So how do they respond to that? So that was the other recommendation. It was also recommended that we develop a joint sustainability plan in collaboration with local and government stakeholders, because programs come and go. The TGG program is coming to an end. When you have local and government stakeholders, then as part and parcel of those that are carrying that torch, then it becomes easier to even talk sustainability, because you are leaving the community members, you are leaving the community stakeholders to actually continue doing that which you have started. Then also to improve and strengthen the synergy between stakeholders in the FGM space, and this included government, NGOs, funders, civil society organizations, and communities. And this is for more impact and sustainability. And then, of course, you can never have enough data in this space. So to strengthen evidence, learning, and documentation process, strategies, so that we can build a pool of evidence helpful for those that are going to come after the program ends, and that can inform others. Next slide. Finally, in terms of context-specific recommendations, of course, I've already spoken to the zero tolerance against all forms of FGM in relation to Somaliland. It is to have and to shift awareness and educational messages to a single strong message that speaks to zero tolerance against all forms of FGM, including SUNA, or any other form of pricking or anything that comes as a form of FGM, that the program specifically speaks to zero tolerance, not any other form of FGM. Also to work another recommendation for Senegal was to work closely with regional and national governments to strengthen surveillance mechanisms to hinder internal FGM tourism, where you move your girls from this community to the other community because it is already getting a bit uncomfortable in your own community because of awareness. The champions are there are people who are looking out, and so you move them to another area, as well as, I would say, also cross-border. And this would include also having collaboration with the police. Also in Senegal, to put mechanisms in place to support girls in their awareness and advocacy initiatives, because they need that support. In Senegal, we've already spoken to, there was a lot of backlash for the girl champions and not getting the support that they needed. But also, the other thing that came out is that there was a lot that was expected of these girls, and they seemed to carry the burden of ending FGM. So it's to put mechanisms in place to support the champions in the work that they're doing because they want to do it, but at the same time, ensure that the responsibility of ending FGM is not put on them. And then finally, also to expand awareness to formal healthcare providers, not only with the health extension workers, but to also link health extension workers to structures, to existing structures. But what we realized in Ethiopia is that there is a lot of work that is being done by health extension workers. But then there isn't a link between health extension workers and the formal health workers. And so the recommendation was that we actually need to do that so that there's that linkage where health workers who are working in health facilities, doctors, clinical officers are also linked and trained so that they can support the health extension workers. As far as it went in terms of the context specific, of course, there was much more, just that we can't present everything. There was much more in terms of context specific differences. Next slide. So after doing the assessment, the POC is over and we have the recommendations, and we've shared that with the partners who are responsible for the work that we do or the results that we get. How have we adapted? What did we do with the recommendations from the POC? We updated and compiled social and behavior change materials, manuals, curricula to ensure that there is consistent messaging and to support scale up and sustainability so that any one of our partners can actually just reach out and get a standardized manual or a standardized curricula that then gives a step-by-step of what we've learned and how to go through certain things, of course, with adaptations depending on the context. And this does not just go for our partners. We are hoping that this is something that is going to be picked by other practitioners as well in the development sector, that they can actually pick some of the materials that we've developed, like what you can see on the screen, the girls club facilitators guide and be able to run with it because the resources already there. Next slide. For AMREF Senegal, they picked on one of the challenges and which also under recommendation, because one of the things was that there was a very high turnover in the areas where they are working of the champions due to studies, marriage, or people getting long-term engagements outside the areas where they were working. And so there was that, and then there was also lack of girl clubs in the remote areas. So how did AMREF Senegal adapt? They trained a whole new 60 young champions in the same communities, but then also integrated a traditional educational approach, community education approach, with the intention that then there's going to be that understanding among the girls and the community in terms of why are they doing what they are doing. They need to understand better the local social cultural context of the work that they are doing or the activities that they are doing. And this finally ended up addressing some of the risks that were faced by the girls, because now there is the marriage of the older, the community education, how the community would expect that girls would carry out some of these activities. What do they need to know? And so there were less insults to the girls. There was less family rejection of girls who were champions, and also mystical threats that the girls were being threatened with. Oh, this is going to happen to you. You are going to have a curse, or this and that is going to happen. So that has lessened as the girls, the newly trained girls, then adopted new ways of delivering education and awareness within the communities. Then AMREF Senegal also are developing, or they have developed a guide for establishing girls clubs. This is about to be published and will be available to be shared to support the creation and sustainable functioning of new clubs, so that the clubs can continue when the program is not there. If the champion phases out, that can still continue. And of course, equipping the new champions to mentor their peers and reinforce girl clubs and safe space models in remote areas, because as usually happens in remote areas, there is not a lot that happens there. So there needs to be consistent support to the girls who are working there, but also ways of ensuring that if these girls are transitioning, then a new group is actually ready to take over, and mentorship then comes in as a strong whatever for that. Next slide. So what is next after the POCs? There has been focus on ensuring sustainability of positive program effects and promoting scale-up of promising approaches through the partners of the TGG program. There has also been focus on sharing learning and resources from the program with the wider and FGM and allied sectors, and these are violence against women and girls sector, the youth sector, gender equality and health sectors. We are disseminating our learning and resources in those sectors, because these are areas where you will find whatever you do, if FGM is happening in that community, they will come into contact with that. And so having the resources that we have produced would help them in that regard. And then, of course, and very sadly, the program activities are closing next year, December 2020, this year, 2025. And so we are going then to be focusing on an end-to-end evaluation and dissemination until the close out of the program. The TGG program officially closes out on September 30th, 2026. But the last 6 months of that is going to be disseminating the learnings, disseminating our findings from the headline evaluation, also publishing and sharing out as much as possible what we've learned. Paris. So back to David.
Yes. Thank you, Jane. That was quite something. Thank you so much for that detailed presentation. And I want also to thank our previous presenters. I know Jane has spoken for quite a bit of time, but she is still the M&E lead. And I would request you, Jane, to have a look at the question and answer section or at the chat box and see whether there are questions, whether there are comments that we can respond to. And also give participants a minute or two. If you have any comments or questions, kindly put them in the chat box, and Jane is there scouting for any comments, for any questions. Jen is on the lookout, and she will be handling that with the rest of the team. So we give ourselves just a minute to do that. I will keep talking. Let's have, type in our questions, our concerns, our comments. I know some of you did not tell us where you're from. Some did not introduce ourselves. You can again introduce yourself. You can say where you're listening to us from. You can tell us where you work. Tell us as much. We want to know you. We want to engage with you. We want to, to partner with you. So give us those questions. Give us those comments. And Jen is having a look at that. So Jen, it's to you now in a minute or so to give us the responses or direct questions to speakers as asked by the participants. Thank you so much. And then I will take you to the next session once Jen confirms whether we have comments, we have questions. Sorry, Jane, your voice is not coming through. We need to make some adjustment. Technical team, kindly. Jen, try it again. Try again.
Yeah, I was saying I'm not seeing any comments as yet. Can you hear me?
Yes, I can hear you. Now that there are no comments for now, I still encourage our participants to ask, to comment, to make, we also take, they are called compliments. You can compliment us, and then allow me to take you then forward to another session where I would want to point out that we have some questions which we are calling post-webinar poll questions, just 4 simple questions. And our technical team, led by Mark on the other side, is posting them on the chat. Kindly have a look at those questions. Yeah, just a few of them. I think there are 3 questions. It's a yes or no. I'm not sure. The first question is about content. Did you find the content of today's webinar useful? Tell us yes, tell us or no, or you're not sure. We also have a second question. It's about learning. Did you learn something useful, something new from today's webinar? Tell us whether you learned something new from the presentations that we did from our technical team. Will you be looking up further resources or events from the Girl Generation Support to Africa-led movement to end FGM? Are you looking forward to seeing our resources? We have quite a number of resources, and we'll be coming to that in a short while. But take a minute or so, respond to these questions, and Mark will be looking at the responses. Yeah, and I will read to you what we have said. So Mark, I hope you have posted the poll. Take that poll, and we'll be looking at it. Mark, I'm not seeing the poll. Yes, there it is. There is the poll. Check the poll. It's clicking. It's very quick, very fast. And I can see, Jen, be on the lookout. We have comments, we have compliments, we have questions on the chat box, and people are saying where they're coming from. I can see them. They're greeting us. Thank you so much. Keep talking. We want to partner with you. We want to know you. We want to know where you are, how the situation is on the other side. Jen, be on the lookout. In a minute, I'm coming back to you. Thank you. So Mark, alert me. Once the poll is done, you can screen the results. Now read to us the results. It's good to know how things went for future improvement. Mark, waiting for you. Mark, are we done? As we do that, allow me to take us back to Jen. I can see the comments. I hope you're scouting for the comments. Read a few to us. There are a few questions. Yeah, Mark, keep that there. I'll read the results, but let's go back to Jane first. Jane, over to you.
Thank you, David. We have people introducing themselves. We have quite a number of people from the program, but we also have people from outside the program, people who are working in the same space. And we have someone actually from Sweden. Excuse me, because I am not sure I'll pronounce your name right. Oregon? Project coordinator from Sweden. And the reason I'm reading this one is because sometimes we tend to think that FGM is only in Africa and Asia. In fact, most people think it's only in Africa. But she says, or he says, I'm sorry, we are an FGM community-based organization to create spaces for FGM survivors in Sweden. And those are some of the issues that migration has bequeathed some of these countries, especially in Stockholm. Then she has also, has asked below how they can get resources. And so I think that's something that we need to provide in terms of how that organization can get resources, the resources that we've talked about, the program resources that we've talked about. We have Mohamed Opondo from KCIU Rifts, who are conducting advocacy in the Rift Valley, and they're also a member of the FGM network in Africa. Thank you very much. We have, they would also want to establish partnership with the girl generation. What can we do to partner with you? That's Mohamed Opondo. Mohamed, we have, in preparation for phasing out, because like I've said, the program is coming to an end, what we've done is we have a civil society network that has been established in Kenya of organizations working to end FGM. That would be a good place to actually find yourself in as an organization that's working to do that. But also visit our website. We have lots and lots of resources there, and David will be talking to that before we finish, because as a program that's coming to an end, we really are not looking for active partnerships in terms of programming, but in terms of sharing our learning, and whatever, you're welcome, and we would like to share that with you as well. Karoki from Isiolo. Great presentation and very interesting project where we will be able to find the material you have mentioned. We will get guidance on where all these materials are before we end this webinar. So webinar for anyone who is looking for the resources, please, you will get that. Yeah, and also some compliments that the presentation was great. Thank you very much. Yes, and yeah, she's a girl. So Oregon is a girl. Thank you very much. Happy to know that I pronounced your name as close as possible to how you pronounce it. Thank you very much.
Thank you, Jen. Maybe one more, Jane, then we close that part. One more.
Joseph Ocheng, Gender and Development Studies student at Kenyatta. He's happy that he joined. We also have, we are purposeful with us, Sierra Leone. Thank you very much. Great presentation and very interesting project. Yes, I think that's just about it for now. The rest our internal team. I don't want to mention them because we have mentioned them enough times. I'm looking for new names.
Thank you, Jane. I know you were scouting for new names. Now we come back to the post-webinar poll, and glad to report that people find the content, very useful. 94% find the content very, very useful, and we have 89% who are saying they have learned something useful or new from today's webinar. 89% have learned from this webinar. And I have seen here about the resources. People, 100% of us are looking for these resources. And I will take you in a minute to those resources. So thank you, everyone. Thank you for your participation, for being very active. And then allow me to inform you then that we have quite a number of publications on the Girl Generation website. Yeah. Mark, I hope you are posting the necessary information on the chat box. And if you look at the resources section of the Girl Generation website, you will find quite a number of documents. You will find some 3 reports, one from each of the countries that we have covered in the proof of concept assessment. Yeah, and the 3 countries we've been discussing. And Mark is posting the links to these reports alongside other many publications in the chat box. And you can have a look and download these documents. You can go to the resources section, download any document. These are free to use resources and they are very useful. We also have guidelines for engaging survivors of FGMs in a safe and respectful manner in programming and in advocacy work. You will find that document of guidelines in the link Mark is providing. You will also find other practical resources to support your work in the End FGM movement. Quite a number of documents from each of the countries, from Kenya, from Senegal, from Ethiopia, from Somaliland. You will find quite a number of those documents. Now, having said all this, again, I want to invite Jane to give us a concluding remark or concluding remarks. Over to you, Jane. Thank you.
Thank you again, David. Yes, I'm going to give the concluding remarks because this webinar sits very squarely in my department, that is monitoring, evaluation, and learning. And so I've been given the honor of speaking last as well. So I want to thank everyone. I am aware that there will be a vote of thanks coming later, but I just wanted to say thank you for those that have participated, taken the time to come and listen to us. And as I reflect on not just the proof of concept takeaways, but also my having worked on this program for the last 5 years, because this program has been going on for the last 5 years. I taken back to how we implement projects. Most development programs usually start with a design stage. And if they are lucky, then they move to a short pilot phase, and then they move on to implementation. And they have their results framework done at the beginning as they do the design. And once implementation starts, they stick to that script, and that script does not change for the life of the program. And they will do that for as long as the funding lasts. And then the program closes and they move on and start all over with another program. Changing the scripts in many development programs, or changing the design, or revisiting the planned interventions and learning and adapting to the circumstances, because we don't live in a static world. Things will always change, is mostly frowned upon. And for some donors and funders, it is not even discussed. It's not acceptable. At TGG, we started off by putting a real emphasis on learning and adapting our approaches as we rolled out the program, because we said we want to learn and use those learnings to improve programming. We also considered the communities that we worked with and the survivors of FGM in these communities as experts in their own right, experts whom the program could learn from so that we could improve our interventions. And therefore, even in our design, we left space to build in the learnings from the community experts as we moved along. And that is why we went the proof of concept way, rather than the top-down traditional way of implementing programs. We wanted to be able to adapt, learn and adapt, come and improve, and ensure that the experts who are the community members where FGM is practiced actually have a say in how our interventions are shaped. So as much as the proof of concept is a real milestone in that regard, we also do acknowledge that it took a lot of work. It was much harder to do, to keep constantly reviewing things and asking what are we learning and how can we adapt, what is working, what is not working well, and how can we improve that. It wasn't easy. But I am convinced that as a result of that process, as hard and as stressful sometimes as it was, we got to a stronger, more effective approach and model in the communities where we're working. Our funder FCDO as well was very supportive in regard to this approach. They allowed us to change our results framework every year to reflect our evolving culture, our evolving nature, allowing us to incorporate what we were learning every year into a new or revamped results framework, so that we are looking behind and we are focusing on what have we learned and how can we take that to then build the results for the next year or to build into the results of next year. And I do believe that the communities in which we have worked and the TGG program as a brand is better and stronger for that approach. We have built end-FGM models that have shown that change is not only possible, but is actually a reality when you invest in communities and let them lead and shape change in issues that affect them. When you don't come as the expert from wherever, when you come and let communities guide and be part of the process and contribute to the work that you're doing, when you look at them as experts who know how change can happen in their own communities, then you come up with something that works. You get better results because they feel they're part and parcel of that process. We are looking forward to other development partners, learning from the learning from TGG's and FGM models in the countries where we've worked, taking them, adapting them to their context, as we all work towards a common goal. And our common goal is the total abandonment of FGM the world over. We've heard that it's happening in Stockholm. So that is our goal. That is our wish. That's our prayer as a program, that others will learn from what we've done. They will take what we've developed. They will shape it and reshape it to fit their context and use that towards a total abandonment of FGM the world over. Thank you very much. David?
Thank you. Thank you so much, Jen, and thank you everyone for participating, actively participating. You can follow us on our social media platforms. We have several of them. We are on X, we are on Facebook, we are on Instagram, we are on LinkedIn, we are on TikTok. Our technical team is posting that on the chat box. And you can visit our website at www.thegirlgeneration.org and our YouTube channel at The Girl Generation. So thank you for joining us, everyone. Next webinar will be on the 3rd of December at 3 p.m. Nairobi time. And we'll focus on a practical guide to setting up girls' clubs in and out of school for abandonment of female genital mutilation, focusing specifically on Senegal. Look out for more information on our socials, and we will send invites through emails, various WhatsApp groups. Wherever you are, we'll endeavor to reach you. Thank you and goodbye. See you next time.